In this video, I help you to diagnose your own low back pain using its location and a quick description, and then we have a look at how to fix the most common ones. If your pain is low in your back, or as a band of pain across that area, possibly with some leg pain, it comes and goes a bit, and it can make your back feel stiff or stuck at times, it's likely that you're suffering from an irritated or restricted facet joint in your low back. This kind of pain tends to get worse getting up from a chair, bending or lifting, putting on socks and shoes, and sometimes even rolling over in bed. It's often the stiffest and sorest first thing in the morning. Sitting in a sagged back position is the most common way of jamming and irritating these lower back joints, so stretching it the other way with something like a mini cobra stretch for a minute 2 to 3 times a day, if it's pain-free to do, is the most effective way to relieve it. Loosening this joint is the kind of thing that chiropractors, osteopaths, and physios that use manipulation can help you with. I'll leave a link to a video below with more exercises to help free up these joints yourself. In comparison, low back pain from a disc protrusion doesn't come and go as much. It tends to stay with you more after you injure it, and it usually comes with leg pain that's more noticeable than the low back pain itself. The leg pain from disc injuries tends to project further down into the leg or even the foot, and often comes with pins and needles or numbness. Coughing or sneezing can aggravate it. A CAT scan or an MRI is the best way to confirm the diagnosis. Disc bulges tend to shrink a bit as they heal, so smaller bulges will often improve themselves over a few months as long as you keep moving and avoid bending, lifting, and impact sports. But if either the pain is severe, the numbness is constant, you get any muscle weakness, or experience any bladder, bowel, or sexual difficulties, see your doctor straight away. If your pain is located right over one of the bony lumps that you have on each side of your pelvis, it's more likely that you're suffering from a restricted or irritated sacroiliac joint in your pelvis. This pain can come and go and can sometimes be accompanied with some upper gluteal muscle tightness. Pain in the SI joint usually comes from it becoming stuck or restricted, so exercises to loosen the joint or manipulation by a professional can really help. So for example, 3 to 5 single leg bridge lifts a couple of times a day with the foot of the painful side on the ground is one of the best ways to release the joint, as long as it's comfortable to do this movement. For more on how to free up this joint yourself, check out the link in the video description below. Now, if your low back hurts a bit further up, in the center, or spread out evenly on both sides, and you notice it when you stand for a while or walk slowly around the shops, it's likely that you're suffering from anterior pelvic tilt, compressing and inflaming your low back joints. This kind of pain makes you want to bend forward to relieve it. The most common cause of anterior pelvic tilt is tight hip flexors, which can get tight and short if you sit all day, or you don't stretch after leg workouts. You can stretch your psoas, one of your hip flexors, by forming a square with your legs, tilting your pelvis back using your glutes and abs, and holding that for 30 seconds on each side a couple of times a day. Then you can do the same with your knee bent to stretch your rectus femoris muscle, which is the other main hip flexor. More details in the link below. If your pain is a deep ache in your upper pelvis, it's tender to press into the muscles in this area, and it feels really tight when you stretch those muscles. Your pain is most likely coming from a tight, contracted gluteus medius muscle, which is pretty common. Strengthening your gluteus medius will usually fix this pain. You can do that by standing on the painful side, slowly lifting and lowering the opposite side of your pelvis, and repeating that until light fatigue daily. There's a link below for more details. Piriformis syndrome is a similar kind of issue, causing pain a bit further down in the pelvis. A tight contracted piriformis muscle can irritate your sciatic nerve though, so it can cause pain, numbness, or pins and needles in the leg. Piriformis pain can be aggravated by sitting on that area all day and will be tender to press. Strengthening the muscle is the key here, so lying on your side, lifting and turning your foot out for a few seconds, and repeating that until light fatigue 3 times a week can really help. I'll put a link below for more exercises for that one too. If you're older, your back pain has been slowly increasing for years, it feels stiff after rest or leaning back, and changes in the weather can affect it, it's likely that you have osteoarthritis in your back. Regular mobilization exercises, rotating your back, bending it to the side, and moving it forward and backwards can really help to keep an arthritic back loose and pain-free. Some cases of advanced osteoarthritis can compress nerves in your low back though, so if you get leg pain, cramping, or numbness that worsens when walking but improves when bending forward or sitting, you're developing some spinal stenosis. A lot of people don't realize that they have a bit of a sideways bend in their spine called a scoliosis. This affects about 2 to 3% of the population. These bends in the spine vary in size, but if the curve is fairly large, it can cause pain and muscle tightness on the outside of the curve, giving you pain on one side of your lower back. Mobilizing your lower back is the way to keep a spine with scoliosis healthy, so I'll leave a link below to show you how to do that. Just note though that if the pain is out a fair way on your flanks and is intense and comes in waves, see your doctor to check for kidney stones. Other things can cause back pain too, so if in doubt, always see your doctor, especially if the pain lasts more than 6 weeks, the pain is severe or worsening, you experience fever, night sweats or weight loss, or any muscle weakness, bladder, bowel or sexual difficulties. The most common low back issue of all though is the tight restricted facet joints that I mentioned at the start of this video. So if your back pain is new or you've ruled out the more serious causes, give these exercises a go.